Sen. Bernie Sanders and other progressives seeking the Democratic presidential nomination are zeroing in on pharmaceutical and insurer profits. Money they say would be better spent providing healthcare for everyone under Medicare for all. My view is that we are having a debate in fantasy world. Insurer profits and excess drug costs are large in dollar terms but small relative to the size of national health expenditures. Their idea, healthcare dollars from government programs, employers and families that are going into the pockets of investors instead, could be used to pay for services. If people want a healthcare system that will not bankrupt them, the answer is to get rid of the profiteering of the drug companies and the insurance companies, and move to Medicare for all, Sanders said during the recent Democratic debates. But research by the Associated Press suggests those dollars might not go so far. While there's no single ledger for drug makers and insurers, the AP found major companies had about $97 billion in profits last year. That wouldn't even cover a couple of weeks in a healthcare system that costs $3.6 trillion a year. My view is that we are having a debate in fantasy world, said Mark Goldwine, Senior Policy Director with the Nonpartisan Committee for a Responsible Federal Budget. Insurer profits and excess drug costs are large in dollar terms but small relative to the size of national health expenditures. To be sure, Sanders and other Medicare for All advocates also acknowledge the need to raise taxes to pay for the plan. It would offer comprehensive medical care to every U.S. resident with no premiums or deductibles, and virtually no copays. But Sanders' legislation does not specify new revenues. Instead, the Vermont Independent provides a separate list of options that include higher taxes on the wealthy, corporations and employers, while promising the middle class will be better off. In a statement, Sanders' office said he believes that guaranteeing health care for all Americans as a right requires ending the profit motive of the insurance industry. It added that Sanders sees a role for pharmaceutical innovation, but opposes a rigged system that allows corporations to use their monopoly power to charge Americans more for the exact same life-saving drugs that can be purchased in Canada, the UK, France, Japan, and Germany. During the last round of Democratic debates, Sens. Elizabeth Warren of Massachusetts and Kamala Harris of California joined Sanders in training rhetorical fire on drug makers and insurers. They had their own profit estimates. Insurance companies do not have a God-given right to make $23 billion in profits and suck it out of our healthcare system, Warren said. Let's talk about math, Harris said. Let's talk about the fact that the pharmaceutical companies and the insurance companies last year alone profited $72 billion, and that is on the backs of American families. For its estimate, the AP reviewed the financial statements of the for-profit, publicly traded health insurers in the U.S. and found they made around $26 billion total last year. Their profit margins averaged a little more than 4%. The list include United Health, Anthem and Humana. Some major insurers outside this group are non-profit and plow their earnings back. A spokeswoman for America's Health Insurance Plans, the main insurer trade group, said the vast majority of premiums go to healthcare. The group's website cites an estimate that about 80 cents of every premium dollar goes for medical care, and only about 2 cents goes to profit. Other expenses included administration and taxes. For drug makers, the AP asked FactSet, a global financial data firm, to run the numbers for major pharmaceutical and biotechnology companies. FactSet focused on 19 companies that are part of the standard. Its analysis found they made $71 billion on revenues of $385.5 billion last year, with an average profit margin of 18%. The list included Johnson. The Pharmaceutical Research and Manufacturers of America said such calculations are too simplistic and don't convey the full picture. Harvard University healthcare economist Amitabh Chandra said focusing on the profitability of major drug makers misses a crucial part of the drug industry story. Many companies engaged in research and drug development don't make money and are instead kept afloat by investors hoping for discoveries that will lead to big returns. It's incomplete, it's not the universe of all companies, Chandra said. It's sort of like saying lottery winners are rich. He cautioned against healthcare remakes that just try to squeeze the profits. There have been some proposals that put 100% tax on pharma profits. That's the equivalent of putting up a giant billboard that says, "Don't make drugs." But Medicare for All proponents have found a simple, appealing argument for their proposal, said Tara O'Neill-Hayes, a health policy expert with the American Action Forum, a center-right think tank. It skips over the complexities of a plan that would put 18% of the economy under government control. It is really easy, and it sells with the general public. Hayes said, "People like to have an enemy, and they like to point to someone as the problem. We've known that for decades." Copyright The Associated Press. All rights reserved. Let's block ads. Why?